morning. This is Octopus 300. This is the auto perimeter that we have in our laboratory at ECC in Vision Care. I know a couple of times this has been used by each of you. So I want to make sure you have a little more in detail, indicators, glitches, instructions, so you can begin to write your own personal manual, which you know is your final project. But now that you're home and you have the time, it'd be a great time to work on it. So leading into this, I just want to let you know this particular manual is available online. Just Google the appropriate Hague Street Diagnostic Octopus 300 PDF, and it'll come up with this particular periodical. You could print it out or just save it to your computer. This particular set of instructions, I think it's hard to find on the internet, but I found it a couple of years ago, and it's just amazing in the detail and simplicity of its writing. So you might want to read it here in the video or ask me and I can send you a copy in an email. So basically it shows you the buttons that you're going to push on the auto perimeter, how to set up your patient, how to different control knobs and so on, what they are used for. And then it tells you what to do with your occluder, your trial ends and so on, fine-tuning the machine. So it's really just a great, easy way of going through what sometimes a manual instruction booklet can be quite difficult to navigate and just plain boring. So this tells you exactly what you should be saying to your patient. Today we'll be doing a visual field, and the purpose of that is to find out what point you go from seeing to not seeing an object. But don't worry, there's no right or wrong answers. All it requires is your undivided attention. So it tells you what to say in a really nice, calm way. Remember, you never diagnose, you never reveal results, but you are very supportive and you're the collector of the data. So after I set you up, you'll look through the eyepiece, and when you do, you will see a cross or an open plus sign. You'll need to look straight in the center of that mark. And then you tell the patient when we begin, you'll see different points of light at different locations. Some are very dim and some are very bright. They will come relatively fast, but they will only come one at a time. Some will be high, some down low, or to the right or to the left. But what you need to do is simply push the button when you see the light or when you think you see the light. And that's an important thing, because sometimes you will feel, and I know all of you have gone through the test yourselves, gosh, I think I saw a stimulus. I'm not sure. So you'll click the button. It's more of a gut reaction. The machine sort of adapts itself to whether you're doing it quickly or slowly. So this is a very important piece of information. In fact, I think I will just scan it so you each can have a copy with your instruction manual. As I mentioned before, this manual is available online. It's the Octopus 300, and it comes in a PDF form. So it gives you all sorts of really nice information. I mentioned in the first video there were 3 different strategies. The 2 to 4, which is what we usually do, the TOP, the dynamic, which is 6 to 8, and the normal, which is 10 to 12. So depending on what the doctor's looking for, you're going to do the test according to the doctor's instructions. So the TOP is the tendency-oriented perimetry. It's fast. The threshold testing, and it reduces the exam time by about 80%. So that's just quick for us to just learn how to use the machine. 6 to 8 is dynamic. 10 to 12, it's a normal strategy. So the TOP algorithm is a systematic method, which takes the correlation of the threshold values in neighboring locations into account. So what that means is that depending on what you're looking for, it's going to test quickly, but in a maybe concentrated area. And it's going to give you certain printouts that your doctor will then read. This is what the printout's going to look at like. There's grayscale, and then there's numeric scales and chart values. It's just many different ways of reporting the same information. When I said to you before I didn't have a patient, because remember, I'm working here on campus alone, this is what I meant. I will show you. So if you didn't turn the control button to off, the machine pauses it. So it's paused, it's running. If the person looks away, it will pause. This is when it's running. So if you keep that control button set to off, despite maybe the patient leaning back or touching appropriately, it will keep running for you. And if we were in a clinical setting, it would be important to know if the patient had lost fixation or had moved. But for the sake of learning how to run the machine, I think it would be appropriate if you just turned it off. So what is testing? Visual fields, again. How far can you see in a horizontal direction? And how far can you see in a vertical direction while you fixate in one central direction? This tests to see how good is your peripheral vision. If you have any questions, feel free to text me or send me an email. And I hope you are all staying healthy.